can start with the diet
Okay.
for the golden age. Uh, Especially the golden age is a golden chapter which is filled with opportunities, wisdom, and fulfillment. So the nutritional needs of the elderly, especially those over 60 years of age, are very different. Activity level decreases and the body's metabolism also slows down. But it is not that therefore they require less energy, but corresponding smaller quantities of food. Even though elderly needs less energy, they need the same amount or even more of vitamins and minerals, like vitamin E, C, known to have anti-aging benefits, as well as protect us from diseases like cancer, heart diseases, and cataracts. So they need more of good nutrition. Like nutrition deserves special attention as people reach older because good nutrition is essential for good health. Healthy aging is associated with number of physiological, cognitive, social, lifestyle changes that influence dietary intakes and nutritional status. So, what are the ways to eat well as you get older? See, now what a healthy plate look like. It should contain a good amount of fiber because elderly people generally face too much of constipation, sometimes problems in bowel movement. So, a good amount of fiber. So, the plate should look like it should have complex carbs also. It should have good protein. It should have a good amount of fiber, which will come from leafy vegetables, and they should stay hydrated. So first of all, we come to energy. Energy requirement reduces. The basal metabolic rate decreases by 15 to 20%. The physical activity is also reduced. So you can find increase in fat tissue. For sedentary male, uh, the calories amount to be 1,883, and for moderate 2,216, and for females 1,706, for moderate 2,007. So this energy, where should this energy comes from? This is the just the parameter of how much they require. But the energy should come from complex carbohydrate. Complex carbohydrates you can find in millets, you can find in whole wheats, you can find in leafy vegetables, and fruits, fresh fruits, vegetables, fortified cereals. This is all complex carbs because complex carbs have low GI also. So if they have high blood sugar levels also, that will help them to lower their blood sugar levels also. And at the same time, complex carbs helps to get a very good satiety. So and they will also help them to watch their weight, as obesity is common because of the increase in the fat tissue. Now we come to protein, decrease in skeletal tissue mass, intake of 1 gram per kg is safe during old age. Protein rich food with milk and curd should be included. Due to decreased appetite and poor digestion, old people are likely to consume less protein, which may lead to edema, anemia, and low resistance to infections. Of the total calorie intake, 11 to 12% should be from protein. So where should we get this protein? A good glass of milk, a cup of curd, or you can make yogurt also. Like if you want to make that curd full of fiber also, so you can use according to the season. Raita can be made like bathua raita, carrot raita, onion tomato raita, any pumpkin raita. This will have a very good amount of antioxidants, very good amount of fiber. It can be topped up with some seeds and nuts, which will also act as antioxidants and will also give good amount of fiber. Dietary fibers, again, fiber stimulates peristalsis. There's a great enthusiasm to increase fiber consumption, but the increase should be gradual. Fiber aids in combating constipation. It also helps in reducing cholesterol, which may reduce the chances of atherosclerosis. Nutritional requirements for the elderly. Adults age 50 plus need 1.2 gram of protein per kg body weight, or 1 gram of per kg body weight is also a good amount of protein. Protein, we can, I will suggest some recipes like For protein, they can, if they are non-vegetarian, they can have daily a whole egg or a chia seed porridge, which is very commonly, I told always to my patients also, chia porridge or chia pudding or chia milkshake, because chia has very good amount of protein. 100 grams of chia gives you 17 grams of protein, and the egg 100 grams will give 12 grams of protein. And chia is also loaded with magnesium, and high magnesium, low sodium, which also help to maintain the this blood pressure. It has low GI, so it will also help to maintain the blood sugar levels. It is fully loaded with fiber, which will help to ease the bowel movements. And it has other nutrients also. Calcium is also very good. In 100 grams of chia seeds, it is 631 milligrams of calcium. So 1200 milligram of calcium daily required for women aged 50 plus and men aged 70 plus. So if we are requiring 1200 milligrams of calcium, so we can, if we are daily adding chia seed in a diet, it will be very good. And it also works as liver detoxifier. Chia seed, why I'm saying this liver detoxifier, because it helps to remove the toxin because of the high fiber content in it. Vitamin D daily, 400 to 800 IU of vitamin D daily for men and women aged 50 plus. 6 to 8 glasses of water daily to aid digestion and avoid constipation. Chronic diseases and medication may require additional dietary control. Calcium, again, the list of calcium food charts, as everybody knows, spinach, this is very good, figs, oranges, almonds, chia seeds, milk, apple, banana, these are all very good, but not to be added too much in the diet. This should be included gradually. Like if you are having some chia milkshake, always soak 1 teaspoon or 2 teaspoons. Start with 1 teaspoon of chia seed, soak it overnight in the milk. Use that milk for making shake. You can add some fruit also to that shake, like banana or an apple. You can add, top up with some sesame seeds. This will come out to be a very, very good nutrient dense drink. You can also add soaked figs. So this is also, one piece is 135 milligrams. This is very good source of calcium. Calcium, again, 1200 milligrams for 71 plus, 51 to 70 years, 1200 milligrams. Now I come to the diet plan, which is totally balanced, which will give you a balanced nutrition, maintaining muscle mass and supporting bone health while being easy to digest. There is a structured plan. Protein is essential for muscle health, like dal, paneer, tofu, curds, nuts, sprouts. Sprouts can be added as evening snack or can also be have as breakfast. Calcium and vitamin D, crucial for bone health, milk, curd, ragi, sesame seeds, almonds. When we come to ragi, always use millets according to the weather, because we are just using it like anything. Millets just become a fashion. Everybody is using millets. So like bajra, the bajra is a winter millet. So all bajra, makka, this is all winter millets, so to be have only in winters. And iron and B12 to prevent anemia, leafy greens, fortified cereals, dairy, supplements if required. Fiber, again, the supports digestion, whole grains, fruits, vegetable, flax seeds, chia seeds. Out of flax seeds and this figs or dates, laddu you can make. It is absolutely sugar free. Do not add any outside sugar. No table sugar required. No good required. Just de-seed the dates and add seeds, nuts to it, and we can make small balls. And this can also be had up with the glass of milk for breakfast, as breakfast, which will fulfill the requirement of all the nutrients throughout the day. Healthy fats, good for heart health, again the nuts, seeds, olive oil, avocado, or mustard oil is as good as any oil. Sample diet plan: morning, start your day with 6:30 to 7 a.m. warm water with lemon or soaked almonds and walnuts, 1 teaspoon of flax seeds or chia seed. But if you're having chia seeds, it should always be pre-soaked, because chia seeds need to be soaked. We should not take chia seeds like we have flax seeds. It should be soaked, but better, I always use it I soak in milk, because it becomes a proper breakfast. With that, you can have a bowl of makhane. Makhanes are also a very good source of magnesium, very good source of potassium, very good source of fiber. You can have makhane atta to your regular atta. Makhane, just makhane you can have for breakfast also. Makhane raita, makhane kheer also becomes a very good proper nutrient breakfast. Makhane raita or makhane kheer. Breakfast: moong dal chila with mint chutney, a glass of buttermilk, or vegetable upma, or oats porridge, or poha with sprouts, coconut, or a glass of warm turmeric milk. Again, the same thing. If you're having upma, or you're having any porridge, or if you're having any poha or chila, please add lots and lots of greens to it, because minimum my idea is to give more and more of complex carbohydrate, which will only come from a good amount of fiber. So always have, like poha you are making, add more of veggies to it. Mid morning snack: go for fresh foods rather than fruit juice. Fruit juice are just fiberless, which will only elevate blood sugar levels, and finally add to the weight. Coconut water, fresh lime water. Lunch: any dal or rajma, chana curry, chapatis, a bowl of brown rice, or regular rice also can be had. A bowl of sabzi, a bowl of curd or raita. Vegetable raita is preferred, or if your vegetable raita is not there, a small serving of salad. Evening snack: makhana roasted with pinch of ghee, or sprouted chaat, or a handful of mixed seeds and nuts and seeds with green tea or a regular tea. Before bed, a cup of warm milk with turmeric or handful of soaked raisins you can have. Stay hydrated, walk daily for at least 30 minutes, avoid excessive salt, sugar, and processed food, ensure regular health checkups. Thank you.
Thank you, Dr. Deepika, for enlightening us on a good nutritious diet. Over to the chairpersons for their expert comments. Anybody can start. Dr. Sharda ma'am.
Very well explained. बहुत ही अच्छा. Deepika, you have explained everything. I think you covered all.
Thank you, ma'am.
Covered all. Nothing you have left. Fiber, which is the importance. And the time lead, I think the time, lunch, breakfast, everything should be in time.
Yes,
time. And otherwise, if you take the breakfast too late, lunch too early, and I think one should feel hungry also, because
yes,
we are agar bio clock you yourself feel hungry at the time if you maintain the time.
Yes, ma'am.
Breakfast and lunch and dinner should be, I think, 1 hour, 1.5 hour earlier than the going to the bed.
Yes, ma'am.
It is healthy. And lunch according to, you have to manage according to the time management also if you are working, but there should be a gap between the lunch and the breakfast and the dinner. And evening the snacks is must. That will reduce the dinner also.
Yes, ma'am.
Well covered. Well
Thank
covered.
you.
Dr. Chitra.
Thank you, ma'am. Thank you.
Thank you. Thank you for
The diet you should
chance to talk.
tell us water also.
Yes.
You have tell. I think you told.
Yes, ma'am. Yes, ma'am.
You covered water
at least
also.
8 to 10 at least 8 to 10 glasses. Yeah.
Okay, you covered. I just
very well covered, Dr. Deepika, and I think it gives us a very temptuous diet, and the menu which we have covered is very attracting to eat, and I think we all should follow. Of course, oily food one should decrease
Yes, processed food.
in that.
Processed food should be avoided.
Processed as
Aerated
well as
drink,
dry.
processed food.
Yes,
Yeah.
yes.
Just
Preserved
just
food,
one comment,
fresh,
ma'am,
fresh
on
food
water.
is important. Everything I think the fresh, कुछ भी है तो fresh
Fresh.
हो तो ज़्यादा अच्छा है. Tinned food and packed
And
food, they are
avoid.
useless, I think so.
Another thing they say that, what our original statement was that breakfast like a king, eat a lunch like a common man, and dinner like a pauper. That should be, I mean, as you grow older, if you follow that, that would be ideal. Because breakfast, you have a good metabolic rate at that time. The food gets digested. Lunch, have a good lunch. But dinner should be your lightest
Very
meal.
light. Very light.
You
So
know?
dinner for elderly or for even I also practice. I have makhana.
Diet and tell them this. And our old Indian tradition of eating before 7:30 was actually very good, because at least as Dr. Shada said, that there should be at least a 2-hour gap before eating and
ma'am.
sleeping.
And one comment I want to make on water,
Yes,
Dr.
ma'am.
Ruby.
Yes,
Dr.
ma'am.
Yeah,
Ruby.
just I mean, as the one shoes does not fit to the all. So my comment to the water, please, it is not all about ki 10 glass of water to the every elderly. Please see what is the kidney status. If a person is having AKD or CKD,
Yes, yes,
or
you're right.
the heart status, because there are a lot of things when the heart EF ejection fraction, or somebody has a problem of the LVF, so we are reducing the water up to the 1 liter only to the people. So that things especially need to be taken care, because I have seen the multiple diet prescription of the patients where they are just with the diet and loading. They are coming admitting to the hospital with the LVF, left ventricular failure, with the pure loading of the water.
Loading of the water,
So
yeah.
that is the important thing.
Yes, very true, ma'am. Very true.
Madam, should we take egg yolk also?
For the
Egg yolk,
elderly,
yes,
madam,
ma'am.
madam, this is also important for the elderly.
Because
कि, after I think dinner के बाद minimum water, और
Yes.
जितना भी पानी है 7-8 बजे तक ले
जी,
लेते,
जी.
otherwise you have to rise up for unnecessarily for the because it increases the frequency of micturition
Frequency of
also in the night, that disturbs your sleep also.
Yes, ma'am.
I would
morning,
like to. Okay.
in morning 2 glass water, lukewarm water is must in all season.
Yes,
Is it
ma'am.
okay to eat fried egg?
Fried egg, yeah, ma'am. It is okay, but you have to wash the oil and the ghee for the
Quantity.
entire day. अगर उसमें ही आ रहा है, you can have like for fat, 3 to 4 teaspoon of fat you can have for the whole day. 3 to 4 teaspoon oil, mustard oil, and 2 teaspoon of desi ghee is required. तो उसी में आ रहा है, तो you can definitely fry in that.
Okay.
I would only like to add to all this that as elderly persons, we have to enjoy our food because it's a lots of emotional importance to us. So, in the meal planning, we have to not only consider the medical needs like kidney disease, heart disease, and other thing. We have to also have our psychological needs. The taste should also be
Yes, ma'am.
considered important,
It should be
and the
palatable.
personal taste
Yeah,
has to be added.
yeah, yeah.
And we see, or in joint family, we often do not take part in food menu making and all that. So we should be made to take part in that. Or we have patients who are in joint families, they don't take part in the kitchen work and all that, but they can be asked about the menu, food menu and all, so that they don't feel left out, and they take part in the food planning as well. Not
Very
only the medical planning and other things,
exactly.
but the psychological needs of the elderly should be taken
It should be
into
taken.
consideration.
True, ma'am.
Another
Very.
thing,
Because food
thing
is
that
an
I
emotion.
wanted, that if we have to enjoy our meals and take a good nutrition, our health should be okay, as has been rightly stressed out, that we have to have a good physical activity throughout the day. If we are able to walk around the house, doing something in the waking hours of the day, we should be active, doing something or other. We should not be lying down or on sitting on a sofa or anything. So that will improve our appetite. We should also have a me time for ourselves. We can go out to the shopping mall or do some shopping, good personal spa and all we can attend to and improve our look and all. That also improves our mood, and we will take a better nutrition also.
Yes, ma'am.
Personal hygiene is one very important thing I feel. We have to hand wash every time we take food, and we should have a good dental hygiene maintained also. And regular sleeping hours are also equally important. If we take a good rest and have a regular sleeping hours, we avoid the screens of internet, mobile at night, then we are more rested. More above all these things, the importance of having a social group, especially when we parents are living alone very often in the house. And if we have a social group in the evening to meet, we talk to people about our own problems or your household activities, then we feel better. So the formation of social groups for the elderly, and we as a part of the groups, then we are better off. Like this group also, we are 65 plus above, we are chatting, we are taking part in CMEs, we are taking part in Sangeet. So this uplifts our mood, isn't it? So that is also important. Another thing that I've observed, that in our colony, which is having elderly citizens only mostly, most of the houses, the children have gone out for study or jobs or anything. So elderly populations are living at home. So if in that situation, I observe that if even people older than me in the colony are not being subjected to routine examination that you suggested in detail. So they are very reluctant. Even the family people are very reluctant to send them for annual senior citizen day or something. When I have tried to organize, then I find that I have to ring up everyone to send their dadis, nanis, everybody to that clinic for these things. So it is very, very important that we address to public awareness also of the senior citizens' health. So that is what I wanted to add to all your deliberations today. It has been an excellent deliberation both ways. Both speakers did very well. And the co-chairs have also added their input so very well. So it was a very wholesome treat today.
Thank you. Thank you,
Thank
ma'am.
you, ma'am. Thank
Dr.
you, ma'am.
Sangeeta? Dr.
Thank you,
Sangeeta
ma'am.
Gupta?
Which oils are best to eat?
Ma'am, mustard oil is the best.
And what others?
Other, like you can alternatively you can change also, like sometimes you can have in winter sesame oil also can be have, peanut oil is also very good, but one should change, but the best is mustard oil.
Right. And desi ghee is good for health?
Desi ghee is very good for health, very, very good, because we avoid desi ghee and have trans fat, which we are consuming from cookies and namkeens and matris, which is not advisable. We have that and skip that desi ghee. Avoid the processed food, avoid the sugary drinks, avoid the bakery products, and have 2 to 3 teaspoons of desi ghee.
Is it good to have kishmish if one is
Yes, ma'am.
obese?
Absolutely, ma'am. Absolutely good.
Dr. Reenu, Dr. GR and Dr. Madhu Bhatta have raised
Yeah,
their
yeah.
hands. Dr. G.
Actually, they were
Dr.
talking, so I didn't. Dr. Madhu Bhatta?
Dr. GR
Dr.
का
Madhu?
बहुत समय से.
Dr. JR, please. Dr. JR, are you there?
Dr. Deepika, I have got one question that whenever I consume excessive or even normal amount of fruits, I start having pain in abdomen. So is it because of the fibers present in the fruits?
Yes, ma'am. Too much of everything is bad, ma'am.
No, not too much. Not even too much, even less than normal. Like I can't take banana, I can't take apple. So what is the substitute for that? Or how to use these, take these fruits?
Ma'am, like, if, tell me one thing, like, if you're having, what time you're having banana, ma'am?
Any time of the day, maybe morning, evening, afternoon, any time.
Banana, like high carbs fruits like banana, grapes, mango, chiku, lychee, this should be have before 3 p.m. And low carb fruits like apple, papaya, pomegranate, this pear, guava, this we can have after 3 p.m. But every fruit we should finish off with the fruits by 7 p.m. because it has a very good amount of, all fruits have very good amount of fiber in it, so it takes time to digest, ma'am.
Nee, but now it causes me so much of difficulty that I have stopped taking fruits. So what is the alternative?
Alternative, ma'am, you can have soaked nuts, soaked raisins, soaked dates. You can have that, or a single fruit at a time. Sometimes if you have a mixed fruit salad, that is not you are not able to digest. So try with some single fruit at a time, ma'am.
Okay, okay, that's a good idea.
Huh.
That at a time, single fruit has to be tried.
Yeah. Because every fruit have different qualities, na, ma'am.
Okay,
Dr.
okay.
Deepti Sharma, are you there?
Yes, ma'am. Can we replace dinner with like soup, paneer, dalia, cornflakes?
Yes, ma'am. बिल्कुल कर सकते हैं, मैम. बिल्कुल कर सकते हैं. That will help you to watch your weight also, and at the same time they are more nutritious. They have low carbs, low vegetable soups like makhana, kheer, and salads definitely have low carbs, low GI. So it will help you to, and you'll feel more energetic also. If you are not having simple carbs for dinner, you will feel more energetic also, ma'am.
Okay, okay.
I think
We have to avoid salads at night, or we can take salads.
We can have, but by 7 p.m. again it goes with the fruit as well, because it has very good amount of fiber, so it will take time to digest. But
That is okay.
if we are having by 6:30, 6:45, 7 p.m., then it's absolutely okay, ma'am.
Okay, okay. Thank you very much.
Thank you, ma'am.
Is intermittent fasting allowed for elderly persons?
Ma'am, it is allowed, but we can do it in some other way, like not 18 hours, not 16 hours, not 14 hours. Like if we are finished, if you are doing 8 to 6, if you are doing 9 to 5, इस तरह से कर रहे हैं अगर आप तो, it's better always when you are on intermittent fasting, in the night just go for some low carb fruit or a cup of milk or a bowl of makhane, जिससे कि ऐसा ना हो कि you go hypoglycemic during night, or in the morning if you have some nausea or dizziness, ऐसा position नहीं आना चाहिए. So have some fruit, not a proper meal during night, but a small serving of fruit or small serving of makhane or a cup of milk you can have. थोड़ा सा वेरिएशन करना पड़ेगा. That's it, ma'am.
Thank you.
Thank you, everyone. So I think we need to close this session now. Thank you, Dr. Divya. Special thanks to Dr. Divya and Dr. Deepika.
Thank you,
And
ma'am.
thanks to
Dr.
all
Renu,
those
I
who
just
have
wanted
joined.
to add one more thing. Like whenever an elderly patient comes to us, and we, of course, ask a leading question about urinary incontinence, at the same time, we must teach her Kegels exercises. And also in yoga, Mool Bandh is very essential and important and effective. So Kegels exercises are another thing that should be taught. Thank you.
Okay.
Madam,
Thank
Thank
you,
you very
everyone.
much. Thank you. It was a wonderful thing.
Madam,
Wonderful listening to all.
Madam, one thing we have to specify, I'm just click in my mind, diabetic should not go for the intermittent.
Yes, ma'am.
Yeah.
But nahi, ma'am, if they are doing some variation should be made. Some variation.
But they should keep in mind their dose,
Exactly.
treatment, and then the diet.
Exactly, ma'am.
Thanks to all.
Thank you, ma'am.
Thanks, Dr. Divya, including myself, and Dr.
Thank
Deepika.
you.
Thank you, ma'am.
Dr.
Thank you,
Divya,
experts.
I talked to you a lot on that day. It's
Yes.
my pleasure.
Is it okay to eat refined oils?
No,
Is it
ma'am.
okay to eat?
No, ma'am, it is not advisable, ma'am.
Okay, but groundnut oil is refined, no?
Yeah, sometimes you can use, but not whole day, not in every recipe you are using. That is not advisable. Sometimes, at times, you can use, but not always.
Right. Thank you so much. It was excellent talk.
Thank you, ma'am.
So finally, thank you everyone. So we'll meet again in the next month. Thank you.
Thank you so much.
Thank you.
Thank you, everyone. Thank you so much.
Thank you, ma'am. Thank you.
Thank you, Dr. Deepika. Excellent. Thanks.
Thank you, ma'am. Thank you so much.
Bye to everyone.